right, okay, looks like we're ready to go. So today is April 19th, 2024, and the Boulder County Regional Opioid Advisory Committee is meeting. And we have, I'm just going to go and say who's here. Robin Bohannon, myself, Claire Levy, Tucker Ehrman, Kelly V, Nathan Bannock, Susan Caskey, Lexi Nolan, Curtis Johnson, and Harold Dominguez. And we are expecting Nuria to join us. I'll just tee up the first item on the agenda. And we have Anjali Nandi, who has just joined us, and Jim Adamsberger. I'll just tee up the first item, and as we all know, I just kick it off, and then Kelly usually takes it from there. So we had discussed at our last meeting potential additions to the operations committee, and so that's the first item on our agenda. Is this you, Kelly? Great.
Yeah, absolutely. Happy to take it from here. Let me go ahead and share my screen. Oops. Put that into actual presentation mode for you all. All right, so welcome again, everyone, to our April meeting of the Boulder County Opioid Regional Council. I will start with a quick snapshot of our agenda and some virtual meeting guidelines. So just as a reminder, this is not a public hearing. This meeting is open to the public. And so if any members of the public are present and have any burning questions or comments, please feel free to put them into the chat, but also please note that they will not be a part of today's conversation amongst the council. Please also remember to mute your phone and turn your cameras off. So our agenda for today, I will start with some usual updates, and then we actually have a guest speaker, Nate Bannock, who's here to speak about one of the programs that we have funded in our last 2 funding rounds. And then I will give an update on the Strategic Impact Grant. This is a conversation that we actually started in our February regional council, but with our March meeting being canceled, just wanted to circle back to some updates in that space. Same for the next agenda item, which was a proposed process for reviewing or endorsing projects, offering letters of support from this council to any applicants for statewide funding opportunities. And then I will talk about our strategic planning retreat and the data product that you all received in advance of today's meeting. That's really going to guide much of our conversation around strategic priorities in the region. And then we will close with next steps. So just a couple quick updates. We have had a number of new settlements landing through March and April. So you can see Teva, Allergan, CVS, Walgreens, and Walmart. These are ones that just landed recently, I believe earlier this week or late last week. We got a notification that they were added to our regional pool. So as of right now, I don't have an absolutely updated number for what that brings our pot to. I did check right before today's conversation to see if it was updated, if the number was updated on that dashboard, but it was not yet up. So I did include the link for you all to follow. That last bullet there, the AG's office has a dashboard that will show you the most up-to-date numbers of what is allowed or what is sort of sitting in our bank account at that regional level. So also wanted to point out some new roster additions to our opioid operations group. This is a conversation that we've had in this space before. We recognized that there were quite a few gaps of perspective and representation on our current operations group, as well as some seats that were represented in the past, but folks had to fall off due to various reasons. And so we wanted to sort of plug those gaps and do the best that we could to do so before our April 23rd strategic planning retreat. So this is just an update on that. We have added some new mountain representation from Kaylin Bradley from the Netherland Food Pantry, also transitioning to a new role as a harm reduction coordinator. We have a university representative, Christopher Lord, longtime standing representative of the university on the substance use advisory group as well. We have what I've called legacy representatives, which are some of those seats where we did have these individuals participating in the past. However, mostly due to capacity reasons, they had to drop off and have requested to rejoin the conversation. So we have Ken Kupfner from the District Attorney's Office, as well as Melanie Judson from the Boulder County Jail, a new City of Boulder representative, Elizabeth Crow, and a new young adult perspective, Charlotte DeGraff. So important to note, these are not the only roles that we were working to fill. We still have a number of other perspectives that we do want to get added into the mix. But these were some of our more successful outreach to date, and we were able to meet with all of these representatives and have a bit of an onboarding conversation so that they're all feeling well prepared and up to speed on the group's activities for this next retreat. Also, on the subject of roster additions, I just want to pause and give a big thank you to our own council member, Miranda. I'm not sure if she's on yet, but Miranda is moving to a new position, and we just wanted to thank you for all of your support and participation in this council group and in this broader conversation around opioid settlement. So thank you, Miranda. And with that, I'm going to pass it off to our guest speaker. I will stop sharing, Nate, if you would like to go ahead and share some slides.
Awesome. Thank you so much, Kelly. I'm going to share my screen in just a second. And I'm going to go into, sorry, just give me a second. Sorry, it's been a minute since I've configured it on this. There we go.
I think, yeah, it's if you just press the slideshow button. There you go.
Well, for those of you who don't know me, my name is Nathan Bennick. I am the National Field Director for an organization called Adventure Recovery. We most align ourselves as a recovery community organization that specializes in outdoor education and outdoor leadership, specializing with individuals within general mental health and substance abuse. So we provide individualized peer mentorship models for the populations that we serve with a clinical and while being clinically informed. So our guides and coaches are all certified in peer mentorship as well as respective outdoor education credentials, while we also have a team of clinicians on our staff to provide clinical supervision for all of our guides to help our programming and individualized and group work that we do to make sure that we're all staying within our scope of practice, as well as how can we best impact the individuals that we're working with. Most of our model, I guess, is very similar to what would be like an outpatient model. So we're meeting our clients within their community, once a week or more or less. It's all customizable depending on their needs and wants and desires. And so I've put together a little bit about us, as well as some of the numbers and impacts that we've had in our first year of receiving funding in 2023 and what we're projecting for 2024. Our mission is to guide people through the internal and external wilderness, cultivating a lifelong passion for learning, personal growth, and adventure. And we are, we use science and other clinical systems to substantiate our mission, and that adventure-based interventions lead to long-term sustainable healing, recovery, and fulfillment. Some of our core tenets are that nature inspires connection, gratitude, and awe. Nature gets us out of our heads and into our natural rhythm. Findings show that time in nature improves one's sense of self, confidence, and pure relations. Gratitude, deliberate immersion in nature and natural landscapes helps us to orient place and purpose in real time. Realizing we are part of nature creates a sense of gratitude for who and where we are in the moment. Research shows being immersed in a lush forest, standing next to a powerful waterfall, or viewing a scenic mountain landscape can encourage more generous, positive social behaviors as well. More about our programming and why we choose adventure is we believe that these skills and time spent out in guided adventures helps create resilience, confidence, and grit. Adventure activities encourage calculated risks and positive limits testing. This type of risk taking develops resilience and self confidence as opposed to risky behaviors associated with substance use and self destructive patterns. Technical and outdoor skill building in the core of developing an adventure lifestyle. The process of trying, failing, and trying again is celebrated and leads to exponential growth, increased confidence, and self mastery. Those who possess grit are able to self regulate and postpone the need for positive reinforcement while working diligently on a task. Embarking on an adventure is a commitment to work through planned and unplanned discomfort and build self respect. We believe that all of these tenets are very core values in the substance abuse and mental health journey, as well as the outdoor journey itself. And these amazing parallels allow us to utilize alternative approaches to um, accessing the results that we're all looking for within our therapeutic journeys. Um, Things that we believe is in how we kind of show up, and this is not an exhaustive list, but just a few examples. Is we really want to encourage self-efficacy within all of our clients and groups. And so a simple question is, in that initial meeting with any of our individuals, we ask them, where do they want to go? Both literally and figuratively. So from their recovery pathway and what it is and resources that they want to obtain in a life that they want to live, but also in the very literal sense of, we are at this park right now, where do we want to go? And we allow them to utilize that experience to really develop that relationship with their guided mentor. And the corresponding skill would be navigation and map and compass skills, while also relating it to navigating their recovery pathway and recovery map as well. We look at mindfulness, whether it be with paddleboarding, rock climbing, hiking, and cross country skiing. So we're really taking in mindfulness based stress reduction techniques and deep breathing and grounding skills. And first, teaching them and introducing them from this outdoor technical skills component, and then helping them draw the connection to their therapeutic skills as well. All the while, we were providing like briefing and debriefing sessions throughout these activities as well, just to make sure that they feel comfortable and confident with the learning objectives of whatever skill we are in. We will reframe, which is an incredibly amazing skill, both from the outdoors perspective, but also substance piece as well. And oftentimes people will say, oh, I want to get to the top of this rock climb, but it's not always possible in their first attempt or go. And so how do we look at a strength-based approach? And we're looking at progress versus, perfection, right? And helping our clients really come to terms and grapple with those kinds of ideas. As I mentioned earlier, grounding techniques, we call it a sit spot within our programming, but looks very similar to finding a peaceful place in nature and allowing our senses to truly be attuned. And so we're looking at all of our major five senses and how we can use grounding techniques within the outdoor setting. Because again, for some people, adventure means going out and rock climbing, but for others, sitting by a babbling brook is just as much of an adventure. And we want to encourage all pathways of adventure and all pathways of recovery as well, because we know that maybe one size does not fit all for anyone. Problem solving, and generally distress traumas as well. And that's a little bit more about how our program works and how we're utilizing our programming specifically with substance abuse individuals as well. In 20, and a little bit more on the neurocognitive side of things, the science showing all of these amazing hormones that we have here. And as we know, especially within substance abuse populations, we're actively seeking substances to activate specific hormones and neurotransmitters. And the reason we do it, unfortunately, is because those avenues work, even though they come with a lot of really drastic consequences as well. So we'll even sit down and do psychoeducation with our clients as well, and go over like what it is that we're searching and why, right? And then how can we find other activities to access and release the same things that we all need. We have these within our biology for very specific reasons, and knowing how to have a level of self mastery within adapting in life is incredibly important. So, how can we use these outdoor skills and outdoor communities to find healthier coping strategies for our day to day life? Sorry, my computer's a little slow. 2023 impact. We served 416 individual client hours, which is actually more than we projected in our original application. These were segmented in 3-hour coaching sessions. We had one scholarship for a professional development training and one for an expedition style retreat. So over the course of 2023, from the time of, I think it was like mid-June when we first received funds till the end of the year, we were able to do regular programming with individuals within Boulder County. Some of those individuals were finding such deep impact and saying, hey, how do I get involved and gain professional skills in this realm? So that's where we were able to scholarship him to one of our professional development trainings to have an accreditation within peer mentorship, as well as gain the fundamentals of outdoors as well. And then one person for an expedition style retreat. Anecdotally, we received a referral for a young adult male who was really struggling, was chronically relapsing, couldn't really get his feet underneath him. We started doing individual sessions. Really were able to build a strong relationship, and went on an expedition style retreat. And during that time, this individual really came to terms with that they still weren't accessing a life of abstinence, which is what they were choosing to pursue. And we were able to then help them find access to treatment, to which now we are able to keep regular contact with that individual, and they're doing really well. And from the time we first met with them, like right before we met him, he had just overdosed and left the hospital, and is now graduating from a inpatient setting, returning back to Boulder County, which is, to me, I think one of the greatest success stories that we can outline in this avenue is oftentimes individuals come to adventure recovery when other pathways aren't necessarily working, even though they're exhausting various different styles, and working with a peer that is outlining truly where the individual wants to see growth versus like feeling like they have to fit and meet the standards of a program. And I'm really allowing us to like come to terms with what the reality of everything is, and having someone come from that non-judgmental approach, because we are all in long-term recovery ourselves at adventure recovery. So we walk the walk and speak the language to a degree. And I was really grateful that even the parents reached out and thanked us for they are noting that we saved his life, but our whole mindset is self-empowerment and self-efficacy, right? Like that individual saved himself by able to have the necessary experiences to come to the realization that he wanted to pursue a life of recovery, of what that meant to him. And we also worked 40 hours of group programming, completing in 3-hour group format experiences. And each of those groups was a minimum of 8 individuals. So we were even able to stretch our programming a little bit further from what we originally had proposed as well, from just that regard, by able to reaching more individuals through the group formatting process. Those were all Medicaid funded organizations, and allowed us to also utilize that more from an outreach perspective as well. So giving people an introduction to what it is that we do, and the opportunity to attend scholarship programming if they so choose. This is kind of going into some of the self-report surveys that we had asked individuals to complete after services. 95% reported negative mental health symptoms improved, either somewhat or much better. 5% noted remained the same. Again, 95% noted symptoms of substance cravings improved during their sections. Again, 5% noted remained the same. 100% of clients noted that time in an outdoor guided session had positively impacted their day-to-day life. And then 97% approximately noted varying increases in their confidence both in their daily life as well as confidence in the outdoors, an increase in their outdoor skills, and an increase in their daily life skills, which goes to our core mission and values of both helping individuals gain access and confidence in the outdoors as well as in the recovery. We were incredibly taken aback by just the sheer number of it. I mean, obviously, with any self-reported survey, I think there's a lot to factor in, but we have since added other measurement styles for 2024 just to be in line with more standard approaches of data collection and other surveys out there, so we can measure against all of the other results out there. And then moving to 2024, currently we have worked with 3 individuals so far. Historically, January to the start of April is a very slow time of year for our individual clients just because the weather and other demographic factors. But we have utilized this time to implement targeted outreach to Medicaid funded organizations and community groups, specifically our demographic data was primarily white male in 2023, and part of our mission was to target more underserved populations, whether it be LGBTQ or BIPOC populations. Unfortunately, I think our outreach strategies naturally are getting we're getting referrals that don't always meet that. So we're really trying to overhaul who we're contacting and how we're contacting them and let them know that these scholarships exist. Because primarily we aren't a nonprofit and offer scholarships. So individuals and where we are in referral notifications and things like that may not always meet the needs of these underserved populations. So we're really trying to combat what people are think of adventure recovery and the populations that we serve, specifically to let them know that these scholarships exist. And ideally, we're projecting similar outcomes to performance as 2023, because summer historically for outdoor activities is our highest months. And as we all know, in the Front Range in Colorado, it can feel like summer pretty much from April until parts of December as well. So we're hoping to continue along the same path that we saw in 2023 and having an ability to specifically target those underserved populations now that we have a little bit more time to complete outreach and already have a little bit of momentum going. I really wanted to thank everyone here on this committee, as well as the public and Boulder County specifically. We are incredibly grateful for the opportunity to help and continue to serve Boulder County. I would love to answer any questions that anyone might have if that's appropriate. Otherwise, I can always pass the time along, and I know there's other things that need to happen.
Yeah, Susan.
Nathan, thanks so much for that. I'll just share that these programs are really close to my heart. When I was a teenager and was struggling with some substance stuff and other kind of bad behavior, this kind of program really helped me. And my parents said the same thing to the instructors, that they feel like it saved my life. So I just want to share my appreciation for that. I also wanted to ask about the data. Do you track the cravings that people are feeling after the session at all?
So all of our data and surveys are given to our clients after after the session to complete, and goes over various different things of confidence and cravings and negative effects. We've since added other measurements of GAD-7, as well as a general quality of life scale that is the standard approach to gather more robust information. I think the only really rate limiting step is after 3 hours of doing really fun things in the outdoors, a lot of individuals will have difficulty following through on that survey portion, but more often than not, we can kind of sit down with them and hand them the iPad or something if they have limitations with the ability to access them at home or in their day-to-day life as well, has been an effective strategy. Or we'll hand them a paper copy and ask them to return it to us later, that we'll fill it in. But yeah, so we ask about cravings after our session.
Thanks. And then my last question is just when you talked about populations that you are trying to kind of bring into the program and recruit, I'm curious about the match of your staff. Do you feel like you have a match of staff that's matching the demographics, LGBTQ or BIPOC staff?
Yeah, we are a smaller organization, but I think we have a pretty decent representation. I think we are limited in our BIPOC population in our staff, but we have individuals identifying in the LGBTQ plus communities and have historically done really great peer mentorship in those realms too. And a large population of our individual clients outside Boulder County actually fall into that. But yeah, I think we can always strive to do better in those ways as well.
Thanks so much. And thanks for everything you're doing. I mean, there's just so much power my belief is there's so much power in these types of programs, and they can be really transformational for people's lives. So thank you again.
Thank you, Susan.
Yeah, Nathan, thank you for being here, and thanks for sharing some information about your program. It does look really interesting. You made a couple of references in your presentation to Medicaid-funded organizations. Are those organizations that or entities that are providing referrals to you, or could you talk a little bit about how Medicaid fits into your financial model?
Yeah, we've kind of we are currently actively searching how to incorporate Medicaid funding into our own organization, but currently trying to partner or utilize these other organizations and community groups from a referral standpoint, as well as to help target specific scholarship individuals who are meeting financial obstacles to receive alternative style programming outside of what Medicaid typically funds. And we are actively searching and applying for Medicaid funding currently for groups specifically at this time.
So do you think you'll be successful, or do you have reason to think that you would be able to get Medicaid funding for this?
Yeah, I think from the peer mentorship side of things is currently we're seeing a lot of movement within Colorado specifically for reimbursement towards that and nationwide. And so we are just making sure that we are up to all of the standards that they are asking for that, because I don't want to use I guess as these standards are being developed, we want to be on the over-credentialed side of things and making sure that we have infrastructure and systems in place that are above standard versus feeling like we are just meeting the standard.
Mm-hmm. So some of your services would be eligible for reimbursement, but not all of them. And I guess I'm wondering about your payment structure model for your clients.
Yeah, so our current structure is, and we do have clinicians on staff, so if individuals are seeking more traditional therapeutic guidance in those regards from a licensed clinician, we are able to provide billing codes for them to receive reimbursement. From a peer mentorship model and a wellness model, it's all dependent on that insurance company whether or not they will accept that reimbursement strategy. However, a majority of our programming falls under private pay, just because we started as a very alternative program and have since realized, we really want to make lower obstacles for our style of treatment as much as we can.
Okay. Yeah. Thank you.
Other questions for Nate? Well, thank you so much, Nate, for being here. Appreciate that. So as a reminder to the council, this will be sort of an ongoing feature that we'd like to plug into these meetings on a regular basis, is to just do a spotlight of some of the great programming that's been funded to date and some of the impacts that they are having in our community, so that you can all see where our dollars are going and the great work that's being done with them. So I'm gonna go ahead and reshare my screen. All right. Whoops, a little delayed. Okay, so I wanted to pick up on a conversation that we started back in February. And as our March meeting was canceled, some of this is a little bit behind the curve at this point, but we still did want to circle back because this was a large part of our discussion with you all in February. If you recall, at the time, we were talking about potentially doing a joint application with our partners in Broomfield County for one of the state's funding opportunities called a Strategic Impact Grant. And really the focus of this was to be around peer support programming that we wanted to stand up, sort of pilot it within one partner emergency department, and then grow to potentially other community partners or community-based organizations that have expressed interest in having peer support specialists, but don't quite know how to recruit, train, or onboard peer specialists. So this was really the structure of our concept as we started working with Broomfield County. And we did get some initial, excuse me, I skipped a slide here. We did get some initial feedback from you all in that February meeting that the concept of doing this across Broomfield and Boulder County sounded good, and there was general approval. However, it seemed like you wanted to hear and see more about the level of engagement or partner commitment, especially when speaking to the buy-in from the hospitals that would be participating in this. And so our approach, having received that feedback, was to go back to some of our initial partners that had expressed interest. One of which, Advocates in Recovery, is a smaller nonprofit that we are partnering with around another peer support grant in community services. And then we also worked with Broomfield County to get additional buy-in from Good Samaritan Hospital and the Refuge, which is a community-based organization within Broomfield County. And an update on where this kind of went. So the impact grant was due March 7th. We got together with our Broomfield County partners one last time, and having started to develop the action plan, we sort of decided it might behoove us to step out on this particular round and to hold our application for future funding opportunities. Really, we just thought we could have additional time to strengthen the proposal and really expand the number of hospital partners. As I mentioned, we really just had buy-in and really committed partnership from one healthcare system. And so with a little bit of additional time, we could really expand that. We also thought about with some additional time to be able to flesh out the action plan a little bit more, we might be able to circle back to our respective regional councils and actually gain a signed letter of support. And then finally, we also knew timing-wise that the innovation and infrastructure grants were right around the corner. So as I said, this strategic impact grant was due in March. And while we still don't know the opening date of the innovation and infrastructure grants, we have been told that it's coming in spring. So I keep checking back to get more details on when those will open, but we expect those additional funding rounds to open anytime now. So our next steps are really, again, continuing to take that high-level action plan, meeting with some of these partners, partner agencies and nonprofits to say, what would it actually look like at the activity level, take some of those goals in the action plan down a step or two, and really get that committed partnership, hopefully have that all well packaged and moving forward so that we can have this conversation again once those innovation or infrastructure grants open up to see if those are a better fit for our application. I'll pause and see if there's any questions before I move on from this.
Kelly, can you talk a little bit about who the partners are at this point?
Yeah, so right now we've met a little bit with Advocates for Recovery. It's a smaller nonprofit. Again, they're working with community services on another grant simultaneous to this that also has to do with standing up peer support infrastructure. And then we also were working in the hospital space or emergency department space with Broomfield County's initial buy-in that they received from Good Samaritan. So those are sort of the primary agencies. Oh, and the Refuge, which is a smaller community-based nonprofit in Broomfield. So it's a smaller sort of cohort. And that was one of the reasons we really wanted to expand out to see if there were other agencies that might want to plug in, and knowing that in order for us to elicit that partnership, we needed to take our kind of higher level goals and actions down to a little bit more weedy of a level. So we're really working on that plan to then gain buy-in from additional partners.
Lexi, I'd also add that the first grant that we're doing with Advocates for Recovery involves about 10 organizations that are utilizing peers as a part of their service delivery model. So that infrastructure grant is really intended to help support the overall approach to recruiting, training, supporting peers in the workforce.
Thank you.
Are there questions about the strategic impact grant or the direction we decided to move with it? So another conversation that we started in February was really around funding applications. So if you can recall, as we talked about the strategic impact grants and the innovation and infrastructure grants, we sort of laid out what is the difference in eligibility across these grants, and is there an opportunity or an appetite for this council in any case to review applications and to offer sort of a formal endorsement or a letter of support. So the feedback that we received from council members in February was that because the innovation and infrastructure grants are primarily government, regional, or municipal applicants, and that ideally they are more aligned with the strategic priorities of the region, there might be some appetite from this council to review or provide letters of support or endorsement for those applications. However, for the strategic impact grants, because they had a broader eligibility, they were open to all sorts of community-based organizations, government, non-government, for-profit, nonprofit. It didn't seem feasible, or really there was not a need to provide oversight or official endorsement to those grants. Also wanted to offer some feedback that we heard, I believe it was in the March, if not the February, learning cohort that the state offers with all of the regional representatives of the settlement regions. The AG's office had received a lot of similar feedback around, there's this need to have the letter of support for any number of these funding opportunities was placing sort of a huge administrative burden on regional councils. Also, having a short timeline didn't quite make it realistic that regional councils would even be able to review all the applicants. There were some concerns that, how do we do this in a way that's equitable? How do we actually vet all of the applications that are going through? Timing wise, we don't even meet frequently enough to feasibly stand up a letter of support or endorsement process. So there was a lot of feedback that the AG's office received. And in response to that, they did say that for that first round of strategic impact grants that were, again, due that first week of March, that they were not going to be waiting letters of support because they recognized how burdensome it sort of was, and they were going to take a new approach in future funding rounds to sort of honor that different regional councils have different timings of meeting, different cadences, different processes to endorse projects. And so they recognized that it was a little bit cumbersome in this first round. That said, we did hear some directive from the council in February that you wanted to see what it might look like if we were to stand up some sort of vetting process, some sort of process to offer a letter of support to applicants for state funding opportunities. And so we went ahead and sort of outlined what this might potentially look like. There's sort of 3 steps. The first is really the step that somebody who is requesting a letter of support from our regional council would go through. And really that would be to fill out a pretty quick template, sort of an application that would be housed on our website. Really, we would be asking them to provide a short narrative of what their program is about and why the work is needed. How do we know that this proposed work isn't already happening within Boulder County? Or if they know that something similar is happening, can they point to potential collaboration opportunities? And then knowing that our strategic priorities will be developed as of next Tuesday, we also wanted to include a nod to how our strategic priorities would fold into this particular programming. So that would be the template of questions that we would ask individuals to submit if they were requesting a letter of support from this council. Oh, I should also say this is primarily the questions that we were asking were sort of modeled off of what your feedback was in terms of why you might want to review certain programs or offer a letter of support, which was we want to make sure that we're reducing duplication, that we have some oversight of, if a program is applying in this community and it seems really similar to something in another community, is there a way for us to incentivize collaboration? And so that's really the framing that we were working with as we kind of templated out the questions that we might ask. And then the second and third part of this process is really reviewing and approving those letter of support requests. Our proposal would be to primarily have this sit with staff and the opioid operations group. So what that would look like is because the operations group and staff will be most well acquainted with the strategic planning process, that we would be the ones to review project requests that come in and make recommendations of which projects to approve for a letter of support. And then the third and final part of this proposed process, I suppose, would be to present you all a list of those approved programs, as well as a short summary of why we thought the program aligned with our regional priorities, why we thought it was unique and non-duplicative, and why we thought the council should offer a letter of support to that applicant. I'm going to pause and ask some questions, but I also want to give sort of a big caveat here. Much of what I'm proposing really will depend on the timeline of the application period and whether it sort of syncs with our meeting cadence, both on the operations group as well as the regional council, right? We had hoped that some of these some of these funding opportunities would be open by now so that we could sort of tailor this a little bit better. Unfortunately, we don't have those timelines. So what I'm asking you for today is sort of a general sense of whether you approve of this process. Does it feel fair in terms of, folks who might want to request that letter of support? And do you all feel comfortable with the bulk of that approval process really sitting on the operations group and staff to approve? So big caveat that some of the timing might change and we might have to tailor this accordingly, but just want to get general sort of temperature on this process.
I'll just jump in to say I'm so comfortable with this approach, having staff and the operations group do that process. I think I'm not really remembering the conversation specifically, but just having a handle on the landscape of services and that are available is really good, and it's good for us to just generally be in touch with that. But from my perspective, and I'm probably the most lay generalist person on this body, I don't really feel like this is the level of work that I should be trying to do.
Thank you, Claire. I think Lexi's hand was up next.
Thanks, Kelly. Just curious if there's guidance for when the requests don't meet the criteria. For instance, if you have two groups submitting something that might have some overlap, or I mean, even down to the point of, maybe they're like strategies that are going in very different directions that actually could benefit from more. I mean, just some of those kind of.
Yeah, it's a good
Mhm.
question. We haven't gotten yet to the level of our selection criteria. I think and we can easily develop that and also bring that back to this group. But generally speaking, it would be around the alignment and the whether or not it aligns with our strategic funding priorities and the duplication. So I would have to play with those a little bit, but those are the primary things that are coming up in terms of how we would measure whether or not an applicant should receive a letter of support.
Thanks.
There are other concerns, though, that I would say have been expressed by the council in the past. So I can throw them out there, but I know this council has been concerned with endorsing anything that doesn't really have a sustainability plan. We also have really wanted to fold in, do any of the programs that we endorse really hold a lens around equity? So there are other pieces of criteria that if you all would want to make sure we are reflecting in our sort of selection criteria, would love to hear those as well. Harold, I saw your hand is up as well.
Yeah, I'm good. I agree with Claire. I'm good with this approach. I think it would be good to know down the road an answer to Lexi's question in terms of what doesn't make it forward, just in case we're asked, we can explain it.
Absolutely. Yeah, we can definitely develop that. Robin?
The only other thought I have is, I think when we see a duplicative effort, if the timing is right, staff could reach out to both parties and say, can you coordinate efforts and leverage the work that you're doing for a bigger bang for our buck? So, and in some places, duplication may make sense, like with the MAT, different providers, asking for services from MAT, et cetera. So I think, as Kelly and others have named, the challenge is going to be the timing. And if the state could figure out some sort of standard cadence so we could expect and plan ahead, then that would be great.
Lexi, did you have another? I saw you unmuted for a moment. All right. Seems like we have a thumbs up on the general process, with the big caveat being time allowing, and hoping that we'll have more details on what this might look like in reality as we get more of those funding opportunities and their respective timelines. Whoops. All right, so I wanted, for our last conversation for today, to touch on the strategic planning retreat. This has been something in the works for a while. We've all been extremely excited for developing not only our strategies, our regional strategies, but also opportunities to get our dollars out the door to the deserving programs in the community that meet these strategies. And so we are going to be diving into this process on April 23rd, which is next Tuesday. Really our primary outcome for the session, it's a half-day session, will be to walk away with those 3 to 5 strategic priorities developed. And then the work sort of sits internally with staff to then translate those priority areas into funding processes, funding mechanisms that will open, still shooting for late spring, early summer. 2 other things to note. One, of the largest pieces of information that we were sort of arming our operations group with in advance of the retreat was a data report that we're going to talk about next. And then also wanted to mention that all of our additional roster members that I introduced in our opening comments will be present. So we were really excited that we were able to get at least some of those those gaps on the roster onboarded or filled and onboarded so that they can join in the conversation on the 23rd. So in terms of the data product, this was sent to you all in advance of today, and really just wanted to talk about sort of our general approach with this, and also how we're planning to use this in the strategic planning retreat. So this is really a conceptual tool that we're hoping can evolve over time. There are a number of ongoing conversations around data indicators, evaluation at the state level. And so we know that this is sort of a moving target, that this is something we wanted to have in front of our operations group before the retreat to provide enough situational awareness of sort of the higher level, more global impacts from the opioid epidemic, but also recognizing that there is a sea of data that is not represented in this. And so just trying to do our best to sort of hit that sweet spot. So important to note that the data and evaluation work group at the state is having a lot of conversation around sort of a set of data indicators that might guide the future of conversations around what data we collect, how we interpret it, and also what we're not looking at and why. And then also at the regional level, you've heard me mention that there are a number of front range regional representatives coming together just to have sort of a shared learning group that's more specific to our own collaboration opportunities as neighboring regions. There is a data conversation happening in that space as well. And it looks very similar to the conversation myself, Tucker, and other staff have been having the last few months about what's the right touch? How deep do we want to go in the data? What programs do we want to include? Do we really want to be in program level data? How do we get the community and our respective leaderships and advisory boards to understand impact without going so far in the weeds that we're losing people? And so that a lot of those conversations are going to shape the way this product will evolve in the future. Also important to note, another couple of ingredients that we were really including as we brought this product together is advice from you all, as well as our operations group and others, to utilize the community engagement tools we already have at our disposal, such as the behavioral health roadmap. We know that that was a huge community engagement process, 2 years long, where over 700 community members were asked a number of questions around behavioral health needs and gaps. Many of those had to do with substance use treatment, recovery, access, and so pulling those themes out and starting from there in terms of qualitative input was really critical. And then finally, the last ingredient for this kind of container of the data product was what we heard from the operations group. We had various conversations with them as well around how do we shape this. The themes that came forward, both when talking about data as well as when we were in our first retreat talking about our vision for the group, is focus on equity, focus on areas you see disparities in access, focus on trends that you see in utilization of services and where those services are being utilized by which individuals, who is not accessing them, etc. So that was sort of the additional ingredient that we had as we shaped this. So where we landed, again, lots of conversation, what's the right touch of data, but we decided on a blending of qualitative information and quantitative information, and primarily where they mirrored each other. So where we were able to find that main sort of narratives were popping up, both in the qualitative feedback that we'd heard from community members and experts, but also where was that being mirrored in quantitative data. So those are primarily where we decided to focus, and those are the narratives that we sort of emphasized in this initial go of the product. I'm going to pause and say a few high-level kind of narratives or examples of those narratives. But I want to say that this list is by no means exhaustive. I think we could easily have a dedicated meeting just to talk about that data report and really dive in. But this is really just to provide a few of those narratives that we saw coming out in both the quantitative and qualitative data. One has to do with higher acuity levels. We heard from a lot of different programs and sort of saw across the data on the access, the level of utilization for some of our programs, for example, our harm reduction programs, the massive increase in folks connecting with services like free naloxone. This could mean a number of things, but what we heard from individuals doing this work in the community is that they are seeing sometimes the same level of individuals being served by their programs, but the acuity level per individual is much higher. They're presenting with a whole host of co-occurring needs. Lots of this started to be exacerbated during COVID. And so they're just seeing individuals that are sort of needing a full gamut of services across the care continuum. Service disparities, another area that you've heard me mention, we really wanted to focus. Show a lot of variance across age and sex in terms of people engaging with earlier services versus utilizing emergency department services. Same when it comes to older adults, seeing that older adults are a lot less likely to present during an overdose at the emergency department. And then finally, we saw a lot of information around service availability and workforce. So we did find some interesting information from the behavioral health roadmap process that showed we as a region, as a RAY region, actually bill for a large proportion or a large percentage of behavioral health providers. So we are actually above average in terms of having behavioral health providers. However, if you break that down into clinicians dedicated to substance use treatment, it's actually way lower than the regional averages. And so what we did is a little bit of digging to see that there's just a much lower workforce in that certified addiction counselor space than other RAY regions, which is a Medicaid billing region for those who don't know. And then also a huge geographic disparity around the providers, with those providers being much more scarce in mountain regions. I'm going to pause, but again, this is not an exhaustive list of the narratives that popped out of that report. It is simply kind of a sampling, but I'll pause and see if there's any questions.
Kelly, can you just say a little bit more about the last sentence and a much lower of community-based services crisis? Is that just general across the whole county, or is that mountain?
Yeah, I apologize. It looks like there's a bit of a typo there.
That's okay. No.
So that too is also across that RAY region. So it's, and I know Tucker can speak to this one a little bit more because this one was primarily pulled from the behavioral health roadmap. But really what they saw when they compared community-based services, specifically focusing on community navigation, service navigation around behavioral health, as well as crisis services, we were much lower than other RAYs in the state. And I don't know, Tucker, did I express that one correctly? Is there anything you would add to that one?
You're exactly right. During the behavioral health roadmap planning process, there was a landscape analysis done by health management associates, and they actually looked at the number of services, the types of services offered by the Medicaid providers in the region, found that in many, we are, like Kelly said, above our Medicaid billing region as well as the state. So things like residential services, recovery services, outpatient substance use services, but then looking at that kind of navigation, connection, and care coordination and community-based services, we were much lower than our Medicaid billing region as well as the state. And the recommendation from that report was some of those services may better target priority populations to help them receive care, like Kelly was saying, and not end up in crisis in the emergency room or showing up in the mortality data.
Do you feel like, well, my understanding is that the Behavioral Health Hub is really kind of starting to market its services now, and that also you're building, in the process of building that crisis team. Do you feel like that will get us to a place where we are better matched at what other RAY regions are looking like? You're on mute, Kelly.
That's a great question. And I might be a little bit biased in that space, but I will say I would really hope so. Yes. I mean, I think what we've seen in terms of launching Well Mind Connection, which is Behavioral Health Hub in connection with the CAT mobile crisis team. What we have seen is a huge appetite for crisis services or anything that sort of sits below the higher acuity that would engage emergency services or even necessarily co-responder services. People have a huge appetite for things that are a little bit lower on that acuity scale, but really involve being able to connect with an individual in real time and work through sort of a heightened instance, but also then to link back to a sustained service provider or service connection. So that is really our sort of ideal, our biggest goal with linking the CAT team with the WellMind navigation team is that bi-directional element would allow folks to present anywhere on that continuum from urgent need to maybe I just need a provider in my community or even go back and forth between the two. So yes, that is my best hope for those programs.
Thanks so much.
Yeah.
Kelly, my question, or
Yeah.
Tucker, maybe it might be a little bit off topic to specifically the data and what the data are showing, but you know, this difference between behavioral health providers, the availability of a behavioral health provider that may focus on mental health versus the lower number of providers that are specific to substance use treatment. What level of additional training and education would be needed to take somebody, you know, an MSW or an LCW and give them that specialty? Is it just two completely different tracks? So there's no transference, or is it additive?
That's a great question. It's a little bit out of my area of expertise, so I'd have to look into a little bit more, but I do know that specifically when we talk about substance use treatment dedicated workforce, the title that this report or this data point specifically was looking at was certified addiction counselors. So again, I'm not totally well versed in the credentialing there, but I could definitely get more information on it.
Yeah, thanks.
So if there's no more questions, I'm just going to move forward to a snapshot of how we plan to use this in the operations group. So the package that you all received in your message on Monday is the same one that our team received. The only thing additive that we put in there for the operations group was a number of slides around interpretation and how to sort of walk through the data product while envisioning how it might connect back to regional priorities or even funding priorities. So yesterday we also hosted what we were calling sort of an office space or like a drop-in session for anyone on the group who had additional questions or comments about how to read the data, where to focus, anything, could drop in and work with Tucker and myself. We also had our data and evaluation lead from Third Horizon Strategies present to answer questions, and then Emily Wolf, our community services evaluation lead. So all of our data minds on hand to answer any questions that the group had. We also provided the operations group a couple extra slides that sort of acted as a decision tree. It pulled forward examples to show if you wanted to focus on impacting this data indicator, let's use like OD death rate, for example. If you wanted to impact this indicator, here's the list of approved purpose funding strategies that might impact that. So it was really just to try and guide the group and make that linkage between if I actually want to impact this piece of data in my community because I see this to be the most important thing in Boulder County, well, then these are the types of programming that I would, you know, raise my hand and say we should fund. Another note about that is we were trying not to be too guiding when it came to interpretation. We recognize that data, you know, it can be interpreted through, it is interpreted through everyone's unique perspective and placement and area of expertise. And so while we were trying to link folks thinking about these data points to how they might represent in a funding priority, we also didn't want to overly guide the interpretation of some of these data points. That was also our intention with keeping them a little bit higher level, more global impact, rather than getting too granular at the program level. And then finally, just using this product at the retreat to dive into some guided decision-making processes by our consultant, Third Horizon Strategies. So these reports and all of the decision trees and things like the literature review that I've also presented to this group in the past, those will all be present for our operations group members to rely on as we walk through our planning processes on Tuesday. Any other questions on that, on the data product, or yeah, Robin.
So when will our group see the strategic, the outcome of all of this and get our ability to weigh in or approve?
Mm-hmm.
What's,
Absolutely.
I know you said late spring, but I didn't know if we had a more clear date of what that would look like.
Yeah, so my intention is to have the regional council in May be totally dedicated to that. I do also imagine that we could draw, easily disperse the minutes from the session, as well as that primary outcome. Like, this is what the group came up with for our 3 to 5 priority areas, so that this council had a snapshot to see sort of our summary of a summary of our discussions, and really the methodology that we took in the strategic planning retreat. So we can easily get that out to this group probably by the end of next week, and then dedicate the May ROC meeting to more discussion.
Yeah, I think that would be very helpful to have that information beforehand.
Okay.
So thanks for that.
Yeah, absolutely. Other questions? Actually pretty ahead of schedule here, so. Great. Well, so our next steps for upcoming ROC will really be that focused conversation around what the retreat looked like, what we came up with, feedback that you all have, any concerns or approvals that you'd like to voice in developing or sort of stamping approval on our regional priorities. And then from there, we'll be sort of translating those into funding opportunities. So just stop there and see if there's any final questions or thoughts. Usually my time management sees me overtime, not under time. But I guess we went in the opposite direction today. So
Kelly, I'll just share just a big thank you again. These are always such great meetings, and I just wanted to share appreciation also for the presentation. I'm liking that that's going to be something that will be incorporated moving forward. It just connects me personally to the work in a different way. So I just appreciate all the coordination that you all are doing, and also bringing in the service providers.
yeah, thank you. And we're happy to continue that. We've got another speaker on the roster. So hoping that can be a monthly addition to this space.
I think that's a nice idea. Kelly, along with, or maybe it was just immediately after you sent out the agenda, there was a PDF of a presentation, which I've got open here on my screen, Boulder County Region Opioid Operations Board 2024 Strategic Planning Data. Is this the presentation that will be used at the planning retreat?
Yeah, correct. So that's the same product that the operations group received. The only thing that they received that you didn't was some of those interpretation and decision-making slides, so that it could kind of guide them in how to digest it all.
Yeah, thanks. Well, thank you,
so-
Kelly. You've done a great job of working through a lot of information. Any closing thoughts from anyone? You can give you back some minutes, 20 minutes in your day if you want them.
I just wanted to know, Miranda, will you be at our May meeting?
Yes, I can be at the May meeting, and then I didn't know what the plan was to replace my spot, but
Yeah,
I'll be at May.
I think it's really up to you and, maybe your town board, because
Okay.
that seat is defined by the towns and cities leadership.
Okay.
So we would be open to any recommendation you all would have.
Okay, perfect. I'll bring it to the board, and at May I'll come back with that.
Great.
Well, maybe it's my job since I opened the meeting to close the meeting then. It sounds like we've got our questions answered. We know what our next steps are. And thank you everybody for joining and participating on this council. It's such an important aspect of the work we do. So I think we'll end the meeting, and I hope you all have an enjoyable weekend. Bye-bye. Bye-bye.
Thank you.